many of us here with pain, but we're not alone. Around 1 in 4 of us in Australia has a pain state that defies tissue healing time. In 2007, chronic pain cost our country around $33 billion a year, which is around one national broadband network. It cost the US 3 times in 1 year what it does to run the wars in Iraq and Afghanistan. Imagine how many wars we could be in if there was no pain. There's a prevalence of around 75% in the missing groups, like people with multiple sclerosis, Parkinson's, stroke, and it might affect 25% of children. It's more prevalent than diabetes, cancer, and heart disease, and we can put up all these figures, but they say nothing about the suffering when 1 in 3 families in our country has somebody in pain and in trouble. So over the next hour, I'm going to introduce you to a really clinical-orientated presentation on treating pain. Note I said treating pain. I don't like to say managing anymore. I think it's a cop-out. Pain's a biological event. It can change. And I'm going to introduce you to the most underestimated, cheap, underused treatment of all. It's knowledge. So I've got 3 aims. I want you to enjoy this next bit when I present some of the most extraordinary gifts of the pain sciences revolution. And then I'm going to turn this science into a clinical take-home formula for you. And then I'm going to discuss how what you hear and what you say out there can powerfully influence your pain. But overall, I just want you to walk out feeling different, knowing that science is on your side. So what revolution, you might say? Well, there is a revolution in science happening. In the last 30, 40 years, we can pick 2 big ones in biology, mapping the human genome, but also mapping the brain. And much of this talk will be based on the science, or gives me the confidence to speak from this wonderful revolution where we can now peer inside the brain of the sufferer. And I have essentially selected 6 gifts, and they are gifts from this tree of knowledge. And I will take you through them now. Gift 1. When we are in pain, many areas of the brain are in action at exactly the same time. Wow, what a gift. When I was a youngster being trained, I thought, and we were taught, that their pain had a little nest in the brain, a section. And I used to think that if I ever thought of my grandmother, that the grandmother section would light up. But how wrong was I? If I think of my grandmother, she's distributed right through my brain as I think of how she moved, how she smelt, her house, any emotions connected to her. Granny is distributed right through my brain, just like her ashes are now. What are you laughing at my granny for? How wrong was I? Because when we are in pain, 100, 400, could be 1,000 bits of brain are in action together. And when we first started to see these extraordinary images, here it is, a functional MRI. It slices. You can see here from the top down the bottom. That's the spinal cord there. And the red areas and the yellow areas are where there's action happening. And when we first saw these 20 years ago, we were just so amazed. Bits of brain had something to do with pain that we had no idea. Smell, taste, memory, hearing, movement. Pain was right through the brain. And then we started to see, well, we could start to draw these images of what we call these neurotags or neurosignatures in the brain. And they've only just put 9 or 10 areas here. They're in action together. It's not linear. It doesn't go A, B, C, D. It goes all on together. 400 parts. Wow. I don't think there's any other gift that's powerfully affected me as much as that. This is the United Airlines takeoff and landing map in 1 year. It's kind of like how the brain works. Get the Qantas map next time you're on Qantas. The New Zealand one doesn't work so well. It's a bit too long. And this picture here, drawn by an Aboriginal woman about 40 years ago, of how she thought the brain worked. And you look at it and I think, how much do we really know? The various nodes, the areas, and all the subcurrents and themes underneath it. Well, so what? What's this got to do with us? How could this gift influence you? Well, the key thing is it underpins the enormous power of context. Say 500 areas of brain are in action when we're in pain, it means that there's kind of a formula for your pain. We're all different and it can be changeable. So, someone with a chronic knee pain might hurt more if they're in a particular place, or with a particular person, or they hear someone say, your knee's totally stuffed, mate. It might hurt more when you add bits of memory to it. It might hurt less when you have knowledge about some sensible treatments or distracted. I try and change people's brains' formulas all the time, often with knowledge, but sometimes a little bit of simple trickery. If somebody had a sore neck turning to the left, I wouldn't say, turn your neck to the left. I'd say, can you put your chin on your shoulder? And they'll often move a little bit better. I'm playing with context. I'm playing with that formula in the brain. So this brain activity happens together. There's no leader. It's a collective summing within the brain. And within this gift, some of these brain parts are mirror neurons. They're bits of brain that fire when you think of moving or you watch someone moving. I bet out here in front of me there are people who may have hurt when they've thought of moving or watched someone moving. And I need to admit that if you'd told me that 20 years ago, I would have thought you were a fruitcake. But I've had to eat my hat. Only last month, a golfer with chronic left shoulder pain told me he can't watch left-handed golfers on TV. Gift number 2. That's, before we go, to remind you of the mirror neurons. That's happening in you right now. You can feel it there. Gift number 2. Many things use the same brain parts. There's overlap. Interesting. 500 areas, but many things use the brain parts. Chrissy Amphlett had it right on, didn't she, when she said it's a fine, fine line between pleasure and pain. In all those fancy brain maps, pain looks the same as pleasure in the brain. Kind of makes you understand people who like a bit of pain, doesn't it? And how about this? If you say something like, my back, it's riddled with arthritis, and then you do something which hurts your back, the brain movie looks almost exactly the same. Language and movement overlap. So what might this gift mean for you? Okay, first of all, when you have pleasure, you're actually exercising brain parts used in pain, but in a good way. You're taking it away from what we call the brain signature. And later on, I'm going to try and convince you that if we can change some of the language we use to describe our pains, that's also going to help it. Gift number 3. Deep breath, everybody, because this is the tough one. But this gift is so rich if you can ride with it. There is no such thing as joint pain, muscle pain, or nerve pain, despite what Pfizer ads tell us. And I bet many of you are there thinking, bullshit. Bald idiot from Adelaide in a fancy new shirt with green glasses. Go back to the poor old long-suffering crows. But bear with me. You see, there is no such thing as a pain ending. Pain pathways. This is the science, despite what you hear and read from people who should know a lot better. You see, joints, muscles and nerves can only send danger signals up to our cord and brain. They do not send pain. Mind you, an infected tooth or a really hot joint can send heaps of danger signals. It's up to the brain to decide, as it weighs the world, whether that information coming in is worth making pain for. The brain is boss. And there are so many stories that would support that. Let me take you through a quick, would this hurt? Would that hurt? If it was that big, it'd hurt. No pain endings, only danger endings. But what would make a mosquito bite more dangerous? If you just read there's malaria in the area? Yeah. If you saw it had red blood in, or that's someone else's blood? If it bit you in the same place? Mick Fanning up on the far right there. You know, the brain must be boss, because here we have a paper cut. Why do bloody paper cuts hurt so much? Did you know they hurt more at work? Bloody work did this. And if you're bored after you leave this talk, go and look up sharkattack.org and read stories about people being bitten by sharks. It really hurts. The brain is boss. When you're bitten by a shark, pain's not really going to be in your survival methods. Sprained ankle like that. I've had one of those. Worse than childbirth, they say. But would it hurt if you were just in New York for the first time and running for the last train home and 7 suspicious people approached you? Maybe not so much. And sometimes there are people who feel no pain. Congenital analgesia. I like telling people about that, and they always say, where can I get some of that? Pain, it's a gift. It's a gift. If you don't have the ability to experience it, you can't report your first appendicitis. A gift. Would that hurt? Wouldn't hurt Steve Irwin, would it? It wouldn't hurt him now, that's for sure. And all the piercings, this common trend in the San Diego area in the US, piercings, the most common surgery done. I've never heard of anybody go into chronic pain after. What's the difference? Someone falls off their chair at work and goes on to 10 years of pain. And yet these piercings, the answer is it's educated. They want it. They understand it. And finally, did you know if you're a violinist and you put a pin in a violinist's finger, the one that plucks the strings, it hurts much more than if you put it in a dancer's finger. Much more. We're talking here now about those 500 areas in the brain, but how it's danger coming up, which the brain weighs and analyses. You've got danger signals coming up to your brains from your bums right now. You've been sitting there for half an hour, there's a little bit of acidosis in your bottoms, and it's going up saying, danger, 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 but you're probably not hurting because the lecture is so interesting. Oh, it's my nice new shirt. Do you like my new shirt? Yeah. Thanks. Do you know?
Look handsome.
Thank you. Do you know that if you think pain comes from the joints, straight from the joints, it means you think that all love comes from the genitals? There's a lot of brain in between. So what does this gift mean for you? What does this gift mean for you? We know if you can grab it and run, you can change. I'm not saying pain's in our head in the derogatory way that idiot health professionals have said for years. Pain is made in our total body, but the brain rules. And we want body structures to be as healthy as possible so they don't send danger signals. But critically, when I'm teaching, when I'm with patients and with students, I want patients and people in trouble to have brains that can weigh the world and subconsciously, unconsciously not turn on a pain movie in the brain. And it's an internal knowledge base that does that. And as best I can, I'll take you to that in the next few minutes. Gift number 4. The nervous system is really an immune organ. Come and join the revolution. We have 1 trillion cells in our nervous systems, but only about 10% are neurons. We had it wrong when we said the brain is a neural organ. The majority of the rest have an immune function. And what I want you to take on here is, look at this beautiful drawing here. The blue ones are neurons, the rest are immune cells in the brain. But I want you to take on this critical definition, our immune systems. A system that we all have within us that knows who we are from a genetic and an experiential base. And that a system which will react when you are not you. And you are not you with infection. You are not you with trauma. But you are not you when you're distressed, bereaved, just don't know, have no goals, confronted by dinosaur health professionals. And your immune system will react and make you more sensitive and maybe even sick. I'll pick it up again in a moment. And a really good term scientists use for these immune cells in the brain are danger cells. They look out for danger for you. And you might like to know that these danger cells in the brain can remain on alert, looking after you for at least 25 years post-injury. So what might this gift mean to you? Well, do you ever wonder out there when pain comes back when you are not you? When you've got the flu? When you're out of sorts? That's the immune system picking up danger and reacting. You might not have hurt yourself at all. just activated an immune system looking after you. And the second thing is this notion of immune balance. It sounds like pop science, but the scientists use it all the time. Our immune cells make these chemicals called cytokines, and it is a balance. Some over here give you more pain, like when you've got the flu. Some over here give you less pain, anti-inflammatory. I'm going to pull all this together in a formula for you in a moment. And there are also known healthy behaviours. Admit, does anybody here read the Phantom? Hands up. Excellent. A battery of tests. The Phantom's crook, you see. His blood has antibodies to every known disease. So does every Banda warrior in the deep woods. No magic, gentlemen. Good, clean jungle living. We can all listen to the Phantom. If we're talking about the immune system, there are immune healthy behaviours. And briefly, they are, for example, the ability to develop coping skills, and that is the availability of help, the perception of stress or how bad you think something is. And I think some people who think my back is bone on bone and there it's totally stuffed might be perceiving something a little bit too much. Social interactions, friends are helpful, belief system, strong, religion, Darwinism, whatever. Exercise too. Nothing better for the blues, mild immune system off balance and a walk around the block. Humour, when did you have your last belly laugh? Intimacy, diet, homuncular refreshment. That's movement. That not only helps your body and your musculoskeletal structures, but your brain. Let's do a few now. I'd like you all to do this, please. Homuncular refreshment. I'd like you to do this. And say after me, no more dishes. You ready? No more dishes. No, go away. Don't hurt the person next to me. Give me a big round watermelon. Slice it in half. And poke your chest through it and grunt. Ooh, didn't that feel good? I want you to make the biggest circle around your head possible. Knock, knock. Come on, knock, knock. Yeah. Beautiful. You've just given your ulnar nerve a lovely wriggle. Now a big knife in your hand. And I want you to stab the person in front. Ooh, and twist it. And look at a bit of liver on it. And now put the knife down and catch a butterfly up here. Then on the other side, cross the midline that people in pain forget to do. Get across. Lovely. You're all homuncularly refreshed. You've stabilised your brain again. Thank you. Gift 5. We are bioplastic. The body is bioplastic. Woof. If you're in pain, it's changes in our total body that's led to chronic pain. But it is changeable. It is changeable. Let me give you one example. Here's a homunculus that many of you might have seen. It's a representation of nerve cells behind your ear up here, and it's a representation of where the cells are that look after your body. So you can see up there, the lips and the hand, you need those for survival. So they're really big. And our brains up there change all the time to look after you. For example, blind people have big fingers in the brain, particularly if they use Braille. It changes. Musicians who pluck the strings have big fingers in the brain. Mick Jagger had his brain mapped recently and he's got huge lips in the brain. I just made that up, but I reckon it could be true. Our brains change all the time, right to our last breath. And we know in pain that it changes too. And this is the scary bit, but this is where we have to. Our brains smudge. It gets a bit fuzzier in the brain, it shifts. And when I'm telling people, I like to use these. Who's got one of these at home? The nail box. Good on you, you press on it. You can put it on your face or anywhere you like at parties, feel free. But if you press on it, this is how the brain works. You know your hand in the brain. You can use it. You don't even have to think, you know it. Each finger moves separately. And it does that because if you press on it, this group of nerve and immune cells are turned on, but these ones here are turned off at a particular time and place. But what we now know happens, this can happen. If you're in trouble, the brain can call upon more areas of nerve and immune cells. Hey, finger in trouble, next finger's in trouble, needs looking after, let's call more in. And it gets a bit fuzzy and a bit smudgier up there. And that initially is a wonderful protective thing, but you don't want it to last for too long. You want that to change back. And there's nothing better that changes it back than quality movement, particularly movements you've done before, and quality knowledge that reduces fear. And in this note, I always reflect on phantoms. The phantoms taught me a hell of a lot. You know, we should have been listening to people with phantom pain for years, because the brain is so changeable. And for example, up here we have the foot next to the genitals in the brain. So nerve cells looking after your feet in your brain are next to the genitals. And for years, people with phantom limb pain, missing limbs, would often say that when they urinate, they would feel a sense in the phantom foot, and we just laughed at them, and I just feel so sorry about that. I like to show people this. It's from one of England's best medical journals. You might recognise it. The Sun. Charles, Truth About Me and Camilla. How I used a train to chop off my leg. 21 operations, young guy, finally said, nah, can't take it anymore. Got totally drunk. Went down to the railway line at Croydon, tied himself to a signal post so he wouldn't get pulled under the train, leant over and put his leg on the line, and the 705 to Brighton went and it's one of the most sad, tragic stories I've ever heard, because he was so drunk he had the wrong leg on the line. That bit wasn't true. That bit wasn't true. My amputee friends think that's really funny. Anyway, he had the right leg on the line, and after it was cut off, he said, oh, it's so beautiful, because it was gone, but it is back. And of course, it, the phantom, was always there in the brain. Pain in fresh air in the brain. And finally, gift 6. Oh, little drawing here. I love collecting artwork from my patients, and this is a drawing done by a woman with 4 or 5 years of pain. A little whiplash she got, a few problems at work, a lot of data entry, and the pain state came that engulfed her whole top of the body here. And most of her pain was in the arms, but she couldn't draw it or couldn't talk about it anymore. Hasn't even got a mouth anymore. Pain that's gone, probably more brain change, hard to describe, hard to get to, but her artwork certainly shows it. Gift number 5, bioplastic. Well, bioplastic. These brain changes are reversible. Pain is treatable. Everything in biology changes. We, that's health professionals, patients, scientists, government, just have to get better at it. Bioplasticity is what led people to pain states, but bioplasticity is what will get you out. And this should give you hope. And a final quick 6th gift, pain is only one thing our brains make to protect us. And if we're here talking about pain and talking about education in particular, there are many other things our brains make to look after us. So if you're injured, threatened, about to make that phone call you've put off for 2 weeks, you can call on many other systems to help look after you. The motor system, sympathetic system, endocrine, immune, parasympathetic. These are all outputs. But what they do, the key thing here, is they will lead to changes like changes in breathing, changes in sleep, make you grumpy, tired all the time, loss of sex drive. What it does, it helps us bring in a whole range of things that in the past we might have thought had nothing to do with pain, but they are particularly important. Okay, I'm going to take you to part 2 now. See if we can take this into part 2 and introduce you to a modern pain formula. And welcome to the world of dim sims. I'm getting a bit hungry. Okay, you'll need another deep breath. And you'll need to roll your shoulders. A vast amount of science has enabled us, including those 6 points, to say this. You and I, we, will have pain when our brains weigh the world, that is, judge everything out there, our circumstances, and decide that there is more danger to the body than safety. And equally, we will not have pain when our brains weigh the world and decide that there is more safety related to the body than danger. There's a kind of balance. Remember I spoke about an immune balance just a few minutes ago? Let's take this danger-safety balance a little bit further. I've given you a handout. There's a handout there with a circle on it. The circle handout. I'm giving you 2 minutes to either, with a pen, or just go through and say whether that statement for you is danger or safety. All right? Start at number 1 and just reflect. With a pen, draw. Even if you just get halfway through, that'll be fine. If you were my patient and in chronic pain, I'd be taking you through this as part of a learning experience. All right. Talk to me here. Your doctor reassures you that you are not alone, there's hope. That is safety. Interest rates on your mortgage go up. Danger. What's mortgage got to do with pain? You've gone over on your ankle, it's swelling up fast. But what if you knew about inflammation and you suddenly thought, look at that swelling, what an old self-healer am I? Your partner says yes to joining your yoga class. Danger. Oh, interesting. All those 500 bits of brain are now coming into their own. You don't see your friends anymore. Danger. You think you're coming down with something. Danger. Your boss is committed to working through the issue with you. Safety. Your sporting hero is back playing better than ever after a similar injury. But maybe you think that bugger's got access to all that expensive treatment. What about me? Your doctor is worried about your pain and suggests seeing a surgeon. Maybe safety. Oh, context comes in. You realise your family are supportive and committed to your well-being. Safety. You've just twisted your knee and heard a loud pop. Definitely danger. I'm going for danger there. Your insurance company stops paying for treatments without explanation. Danger. A trusted friend recommends someone specialising in a cure. Safety. Danger. Oh, wow, we're all different. You come down with a flu. Danger. You're told you have, unless you really want to get out of something, you're told you have fibromyalgia, now you have to live with it. Danger. You reconnect with an old dear friend on Facebook. Safety. Your partner thinks you should just snap out of it. Danger, usually. Yeah, bloody partners. You finally get an appointment with the best surgeon in the country. Safety. Your family pet dies. Danger. Unless it was a mouldy old flea-bitten rabid thing. All right, so what you've done, you've seen in that in us all, we're different. And there's this context that comes into play very, very powerfully. So credible evidence of danger. You know, going to the same place where you first injured your body. Hearing there's nothing wrong with you, so your pain's not real. Believing you might end up in a wheelchair. Receiving a diagnosis that sounds bad without really knowing what it means. Some of you might have heard, somebody came to me recently and said, I've got Sherman's disease with 7 Schmall's nodes. I said, come right on in, we'll sort that out. Credible evidence of safety, making an appointment to see a health professional, being aware of a scientifically proven path to recovery, knowing you're not the only person here, and look at the stars. Danger, interest rates going up again, knowing someone loves you is actually credible evidence of safety. But we need to bring this in to the overall pain formula. Okay, so you've done that exercise well. I'm now going to introduce you to your dim sims. All right, we've got 7 varieties of dim sims. I've only drawn 4 here, but I hope we can have a few later with a few beers. Would that be all right? The dim sims. A dim is danger in me, and a sim is safety in me. All right? And what it is, it's a pattern of activity in the brain. And the dims and sims can be categorised. Here they are. I'll read them out. And you've also got this little chart, the next chart coming up. The first one is the things I hear, smell, touch and taste. A dim for some people could be the smell at the dentist, or hearing you'll need a wheelchair soon, or seeing Mick Fanning if you're a surfer. A sim could be hearing the scan is clear, or the feel and smell of your own bed out of hospital. The things I say, a dim could be someone saying, I'm riddled with arthritis, it's bone on bone, I've got 1 foot in the grave. But a sim could be saying, there's light at the end of the tunnel, or the ability to just articulate to someone why you're hurt. The things I do could be a dim, could be just staying in bed. No exercise, just taking pills. But a sim could be reading something, a walk around the block, ringing up an old friend. The things I believe or know, a dim could be believing pain is forever, or that insurance has it in for you. But a sim could be knowing that you grow new neurons daily, or knowing you have health insurance, or reflecting on the fact that you live in Australia. The places I go, a dim could be hospital when you know there's a staph infection. A sim could be hospital when you know there's no staph infection. We all have safe places, and they're sims. The people I meet, a dinosaurial health professional could be a dim. Bronwyn Bishop might be a dim for some of you. Death of a loved pet's usually a dim, but there's wonderful sim-producing people out there, and there's many in front of me here. My wife's been ill and not long out of surgery, and she had a new haircut, bought a new dress, put a bit of lippy on, walked out in the street, and this totally unknown woman just walked up and said, you look stunning, and walked on. I thought, what a sim. I didn't have to pay that person anything either. The things happening to my body, the final category here, damaged body parts, the hot inflamed joints, acute inflammation. But I often with patients try and say, inflammation, you old self-healer, you're on the way. But it also could be emotions are dims, disgust, anger, anxiety, but happiness and positivity are sims. So remember the pain formula again? You will have pain when dim power outweighs sim power. Remember I said 500 bits of brain in action? Plenty of space for all of these. Remember I said the immune system there, picking up when you are not you? It's all picking up, and this is what's happening in the balance. These dims and sims drive a metaphorical protectometer. I've drawn that for you. Dims send it up, sims send it down. And here's the numerical rating scale that many of you would have dealt with. This is the pain zone. Up here, call an ambulance now. Down here, you're having a good belly laugh with good friends in the safest place you know. Couple of points. A couple of points. We can find these dims and sims, and you're with a patient, and when I'm with a patient, we would find them. I've given you the list. I've given you the list there in your notes. I hate selling books, but this is part of our little Explain Pain handbook that we've finally put out over 10 years. But a couple of points, critical points. Dims and sims hide in hard-to-find places. ISIS, mortgage, mum in the nursing home, Bronwyn Bishop. What's that got to do with our pain? But it does have something to do with our pain. Sims, the awareness somebody loves you, your health insurance, going to yoga with your bestie. Some dims and sims hide in never to be told places. But at least if you're aware of them, at least you've done something about it. And the tragedy is the health industry focuses on dims, not sims. And that's why it's easier to find dims than sims. A good friend of mine rang me only 2 weeks ago. Her sister died, rheumatoid arthritis from early age, blind and tumours. But she said, I've looked at that dims and sims, and now I know why she lived so long. She was a sim hunter right through life, and that must have had an immunological effect. There is an alert zone too here, a little alert zone. Do you ever wonder when you're out there, have I got a headache or not got a headache? And then when you think, You got a headache? Yes, you have got a headache. And that's because there's lots of big DIMMs around, and then one tiny little thing, even the thought that you've got a headache, is enough to turn it on. We call this the bilby in the bath. So here we have me in the bath with lots of big DIMMs. No, that little bilby is going to make the bath overflow. We're blaming the little thing, not the big ones. Colleague in Queensland with an 11-year-old daughter with irritable bowel syndrome and chronic gut and pelvic pain has this picture on her wall now, and they're trying to work out what is a bilby and can we deal with some of the other big issues out there as well. So the treatment aim is simply to decrease DIMMs and find SIMs. That would be a very sensible thing to do. And there's nothing better than education. And in particular, I'd push biological education targeting DIM-SIMS categories, explaining why the things I hear, the things I say, the things I believe, the places I go and the people I meet can hurt. And we're talking here about clever explain pain strategies. I'm not trying to sell a book, it's just that the majority of the randomised controlled trials have been based on this kind of book. This kind of work, knowledge, has Category A evidence with the National Health and Medical Research Council, which means the body of knowledge can be trusted to guide research. And I would like to say that if you're in chronic pain, knowledge has far, far better outcomes than the most powerful drugs known to mankind. I've selected a couple of these areas to discuss for the last 20 minutes. The things you say and the things you hear. Right? We can't deal with it all, but these are the two I've picked, and I'm going to give you a few thoughts. Part 3, the things you say and the things you hear. Let's analyse it and see whether we can make some changes here to our protectometer. Okay, the things you say as DIMMs. Now, most of our language is metaphorical. Perhaps nearly all our language is metaphorical. For example, it's raining cats and dogs. He's a pain in the arse. It hurts like hell. I've got mum's knees. No, you haven't. You've got your own knees. At least you're on the right side of the grass. And we use this for humour. We use metaphors all the time. We use it to discuss intimate issues. How's the waterworks? And metaphors are as much, that's our language, a product of your lived experience of pain and disease, but metaphors can also be used to transform that experience. So essentially, a metaphor or little saying you might be using could be a DIM, but it could be changed, adapted, shot down and made into a SIM. Much metaphor theory comes from this wonderful book by Lakoff and Johnson, Metaphors We Live By. But the essence of this is that metaphors are everywhere. They shape our communication and how we act, and our stories kind of become us. Right? For example, I'm riddled with arthritis. If that's said all the time, there's a signature for that in the brain. It's essentially a DIM. And I ask you, would Usain Bolt have run as fast if his name was Usain Plod? I'll get you to reflect on that. We have no idea. I asked 200 Victorians, physios, over 2 years, this is about 3 years ago at La Trobe, I asked them to, for 1 month, when a patient says a metaphor, a story, write it down and we'll put it together and we'll see what it all means. And I've selected some of those. One metaphor that's often used are these simple structural equalising metaphors. So people say, I've got barnacles on my arm, right? My knee's like a rusty hinge, muscles are all knotted up, I've got the fibro, the back goes out. So we hear a lot of these, and there's nothing really wrong with it, but I'd like you just to reflect, and if you're saying this, don't leave it at that. For example, the knee is a rusty hinge. I might say to someone, well, let's put a bit of oil on it. I don't say spray WD-40 on because people have done that and it doesn't work. Your knee's more than a rusty hinge. It's a beautiful device that loves a little bit of compression. A hinge only goes one way, yours goes both ways. It loves blood and movement. It's taken you through life. You've got 2 of them. It's much more than a hinge. Or even knotted. If you think you've got knotted muscles and someone says, I'm going to stretch them, you tighten up the knot, don't you, essentially? So basically, all we're saying here is seek a little bit more knowledge than staying here. Back goes out, where to? You know, put some more kerosene on it. It can't go out. So it's up to health professionals, but also patients to seek a deeper knowledge. There are also what we call ontological metaphors. Now, what that means is it's an attempt to give something abstract a voice, and pain has no object. It's got nothing to link it to. Like coffee's got smell, hasn't it? And sound's got Johnny Farnham. Touch, I like Johnny Farnham. Touch has silk. Vision's got the National Gallery. It's got object linkage. But pain doesn't have this, which makes me understand how so many people out there hold on to the little words that health professionals say. A little bulge here, a bit of wear and tear there. And what we see is language emerging like this. These are people trying to make sense of their pain state, to give it some linkage. My mind feels fragile, that's linking it to something broken. It comes out of the blue, linking it to the sky. I'm falling apart at the seams, linking it to clothing. I'm going to pieces, breaking. This, if you're saying this, and if you're a health professional hearing this should be grounded. And there are stories about brain change and multiple areas in the brain engaged in pain that should be able to ground this and make sense of this. And indeed, it might just feel as though you're going to pieces if you think of how many DIMs out there may be linking in to your particular pain state. And it also goes on, the notion of journey and container. People say, I'm at a crossroads. Or it could be the other way, smooth sailing, that's a sim. But I'm at the end of my rope, I'm in struggle street, the youngsters say. Full up to here like a container. If you're hearing this, if you're saying that, then you're actually calling out for goal setting, direction, graded activity. So if you're saying that, that's what you're looking for, and if you're a health professional, that's where you need to go. And then we have invasive metaphors, where people say things like, it's deep in near the screw, it's inside my head with a hammer, it's like a knife in there, it's degenerated. Here's one of the most well-known images of all time. Frida Kahlo perhaps expressed pain in art better than anybody. After the Second World War, 22 operations, if you've probably seen the movie or read the story, a trolley car accident where a rod pierced her pelvis, broke her back and came out of her pelvis. And she's drawn this, and it's called the broken column. And I would say here, Carlo, we can see the widespread pain here. We can see the broken bone was the L2, so you can see something in the dermatome here, but it's the broken column. The column has become her. Right? Just like someone who says it's like a knife in there. Remember I said the immune system's so powerful in pain? It's like a knife in there. In the brain, immune cells will be kept on surveillance looking out for the word knife. Every time you say knife, it keeps it sensitive up there. And you can actually make your own neuroimmune knife up in the brain. So the key thing, of course, is to, yes, change the language if you can, but I think first of all, we've got to come back to understanding that repeatedly saying it or hearing it is actually keeping you on alert. It's a DIM, keeping you sensitive. And then we have the prognostic metaphors people say. It's stuffed, it's rooted, 1 foot in the grave. It's just old. Oh, I hate it when people say it's just old age. My knee, it's just old age. I say, what do you mean? Is that knee older than that knee? Yeah. Or this back, it's old age. Is that side older than that side? Challenge ageism, particularly as I'm getting older. And if you think it's just age, that means you just look at one thing. But I've told you 400 or 500 areas of brain are in action in a pain experience. Prognostic metaphors, they should be challenged. We are bioplastic right to our last breath. We make new neurons right to our last breath. These are DIMs. Try and seek out better SIMs. Let's give you some new flight plans. We change to our last breath. I'm trying to get a grip on it. Rome wasn't built in a day, are useful. And finally, there's disembodiment metaphors. And I hear this all the time. I hate my leg now. People with stroke call the arm George. Come on, George. We're trying to change that. That's disembodiment. I want a new one. Oh, the back is killing me. The back? What about my back is killing me? That's a form of disembodiment. It doesn't feel like mine anymore. Just briefly, I have a friend who's a bishop, and I don't know how I got a friend who's a bishop because I'm at the other end of the scale. But we're good mates and we go out and have a few drinks. I think he sees me as safe. And not long ago, I was with him and I said, how's your wife? He says, oh, mate, she broke a foot. I said, oh, is she all right? because I knew she had rheumatoid arthritis. Yeah, she's broken her foot. We went to the Royal Adelaide Hospital. They put a pin in 6 weeks ago. I said, how's she doing now? Oh, mate, she's still in a moon boot, not moving, hasn't taken off the sticking plaster that they put on in the hospital. It's all gone a bit hairy and a bit smelly. I don't like it. And she's saying she hates it. I said, I better come around and have a quick look. So I went around. I'd fallen off the system, no further appointment. And I did what anybody here would do. It's called Rehab 101. Let's clean it up. Let's start moving. Husband, you massage this. Try and move it. Come on, you can hang the foot over the bed and pretend you're walking on a tomato and get a bit of pressure on it, get a bit of wiggle on it, do a bit of left-right discrimination, cross the midline, all this sort of stuff. Get a bit of therapy between the toes, a little bit of balance playing. Imagine walking. Lots of things like this. Anyway, I saw her 2 or 3 times, and on the 3rd time, I walked out and my friend said to me, thanks for coming over and seeing her, Dave. And he looked at me and he said, you just got her to love that foot again, didn't you? And I said, no, mate, it's much more complex than that. And then I thought, hang on, no. That'll do. Got her to take the foot back, to re-embody the foot, to put the foot back in the brain, to change that essential smudginess in the brain, to make it SIMS, which is essentially a neuroimmunological thing in the brain. So, I'll just give you 3 of my favourite metaphors that I offer back in therapy. Motion is lotion. Anybody use that? Who's going to have it? Who's going to try it? You do. Good job. But I would never say, hey, motion is lotion. Give me $50 for that. I'd say, hey, motion is lotion. If you can do these wonderful activities that we're planning, you're going to put a lovely oil on the joints, you'll get oxygen deep in your lungs, your blood will be half as thick, you've got less chance of getting diabetes, your brain will be enriched. Motion is lotion. It's what we call powering up the metaphor. Please feel free to use motion is lotion. It's also for the brain and the body. Another favourite I like to tell people in metaphor use for transforming is be like a chameleon. And most people think, what? What's a chameleon do? It changes. It changes behaviour. It seeks out. Keep moving. Keep exploring. Keep out there or you'll lose the power. Be like a chameleon. And a favourite one, I love my quotes, Bob Marley. When the music hits me, I feel no pain, said Bob. He's probably on a lot of marijuana and a lot of other things, but it's a wonderful example of context. So what Bob's saying there, when there's other things happening in the brain, pleasure, there's not much room for pain. I'm going to finish with 3 short stories now, 3 pain stories. This is the Twin Peaks model, some of you might have seen. It's from Explain Pain, and it's the most widely used image in Explain Pain. I even hear that Prince Charles has it by his bed. I don't know what that's done for the royal family, but anyway. But I'd like you to take a look at it, and I'll drop back into a language I might be with a patient. Before you hurt yourself, you could have climbed a mountain, or run a marathon, or sat on the tractor for 2 hours to get the wheat off, or if you're an accountant, maybe done a day's work on the chair. Adapted. Back then, there was a certain time when you would have challenged your tissues. Bit of overuse, extra wear and tear, sitting on the tractor, soggy, boggy tissues. But there was always this protect by pain, our beautiful brain, this gift of pain, basically comes in earlier and says, danger, 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 get off the mountain, off the tractor. You can say, stuff it, I need to do it and get through. Superhuman, but we can do it. What happens in much chronic pain now, 5 years later, and 5 years is usually long enough for things to heal. Yes, please say yes. Tissues can be still unhealthy and need help, my word. But what often happens here is there's a new tissue tolerance now. It's not quite as healthy as it was before, but our brains, our wonderful brains, have protected us so well, particularly if there's far more DIMS than SIMS, and there's a new protect by pain line down here. And the person says, it hurts now when I walk up a small hill, or sit on the tractor for a short time. Or my old farmer friend from York Peninsula said to me, I don't tell too many people this, Dave, but when I look at my tractor now, it hurts. And that's the mirror neurons probably coming in. But if you look at this powerful thing here, the big difference before and after is the buffer here. And can you see that someone who might go and sit on a tractor, do a little bit of activity into a little bit of pain, knowing it won't damage their tissues, if they can come here and say, yes, I'm sore, but I'm safe, then that is a real win for the brain. Second thing I'd like to show you is a back. Check out my x-ray, mate. The back is stuffed. This is a typical x-ray of a 50-year-old. Right? This particular person wanted to go and play bowls, but look at my x-ray, mate. It's stuffed. And he took me through it and he said, look at this, there's no space here. But these here are actually, in the spine, quite normal changes. He said, what about this big beak? I said, that's actually what we call an osteophyte, and it's grown to protect you, and it's actually given you a nice solid base. In fact, your back is now really more of a stable platform than anything. You can play bowls really well on that. But what about the nerve? Couldn't it be irritated? There's not much space here. Nobody ever tells people that when nerves exit, they only take up a third of the space. And they're adaptable. Most of the rest is fat. This here is essentially the kisses of time, but it's actually quite a normal back. And it can be de-threatening DIMS. Of course, this has to come after a really quality examination. And I want to finish with a story that I like to tell everybody. It's called The Drug Cabinet in the Brain. And I think everybody needs this, particularly people who might be coming off meds and wondering what's next and not knowing that there is something else that can actually help you. Okay, tell me, yell out, what are some pain-killing, I hate that term, pain, but I'll use it, pain-killing meds you can get from the chemist? Yell some out. More. Lyrica. More. Oh, there's lots, aren't there? More. Beautiful. Tell me some that your own brain can make. Oh, you're not bad, but isn't it interesting? You knew the ones from the chemist more than the ones your own brain makes. Your brain has its own drug cabinet. And let's say them, but we're going to say them in a sexy way. Your brain can make serotonin, enkephalin, morphine, something very much like morphine. We have in our own brain our own drug cabinet. And it's open 24/7. Anzac Day and Christmas. No prescription needed. Free. No side effects. We're grateful for the medications, particularly for the more inflammatory states. But when you get to chronic pain, as we know, they don't work so well. But there is a system here that can. So I like to draw it. I'm not much of a drawer, but I try this. Here's the brain. Your own drug cabinet, it's in there. Nerve cells in the middle. And when the cabinet is open, all of these happy hormones, I call them, serotonin, morphine, enkephalins, pour out. And so messages coming in, danger messages, remember, come in. But they may go no further. The footballer who can finish the game, knowing there's 2 minutes to go, I'm 32, something bad's happened to my ankle, will I come off? No. Or the Greek grandmother with triple fibromyalgia, who's decided that she wants to cook a dinner party for her daughter getting married and invite 16 people around, has got this choice in the brain. It doesn't have to go any further. Ever been out to a little bit of a slightly wilder party and you do a bit of dancing and you come home and you think, where'd that bruise come from? Something must have happened and it didn't go any further. Drug cabinet open. Now, just as our own pharmacy industry has to answer to a higher authority, so does the one inside us. And the key thing it has to answer to open or close is it worth me having pain now? Is it worth me having pain now? So someone's been injured and they've gone back to work. They've gone to the cold room where a big slab of beef's fallen on them and hurt them. Is it worth them having pain now? Probably yes. Danger. Drug cabinet is closed. Or driving past the place where you had the whiplash. Is it worth you having pain now for the first time? Danger there. Brain thinks safety, sensitivity. Yes. Drug cabinet is closed. Or the sports person just about to finish that game, injury, but you want to get to the end. Is it worth you having pain now? No. Drug cabinet is open. You're about to have a bit of a cuddle and rumpy-pumpy with your nearest and dearest. Is it worth you having pain now? Sorry. The answer theoretically is no. Drug cabinet is open and all that beautiful serotonin just pours out. So you see, There's a key to the drug cabinet. Tell me, what closes the drug cabinet in the brain? DIMS, which could be closed minds, no goals, no guidance, dinosaurial health professionals, nobody listening. What opens the drug cabinet? SIMS, knowledge, direction out there. And there is a new direction out there in science. So I'll finish up by saying we're going to have some later. Yes, definitely. So thank you. We've covered wide areas. The science revolution, DIMS and SIMS, and some pain stories. But I still need to say it is such exciting days in the world of pain and neuroscience, but I'm still aware that we have to make it much more exciting for the sufferers as well. And events like this, I would go a big, big way into doing that. So thank you very much for listening. Thank you for coming.
Wow. Thank you, David. Now we've got some time for some questions. So if you have any questions, please make your way to one of the microphones on the sides. If you absolutely can't make your way there, please just pop your hand up and we'll get someone to you. As our time for questions is limited, please make sure your question's short, to the point, and if you could refrain from any follow-up questions so that someone else can have a go as well, please. Please also just be aware that David may not be able to answer questions specific to your condition. So, yeah, give him a bit of a break.
Thanks.
Also, just to remind you, tonight's presentation is being filmed, so if you don't want to be filmed, please don't ask a question in public. Editing's just really tough. So, we'll get started. Come on, you're not shy.
It can be questions on love and life, anything. Thank you.
Hi, David. I often hear high pain tolerance and low pain tolerance. Is that the DIM-SIM factor?
Probably, yes. That formula fits quite nicely. We all have the same pain threshold, of course, so if you put something hot on us, we usually say it hurts at about the same temperature, but the word pain tolerance, I think, is the ability to handle it or understand it and get on with life. And it's very often people who've got a SIM load. And sometimes they have what we call super SIMs, so they can combine those categories together. And there's something like the walk on the beach with a dear friend with some music is what we call a super SIM. It adds 3 or 4 things in. But the key thing for me, I want people to know that also links in to the overall pain production. Thank you.
Also, if I could just get people to state their name when they start too, that'd be nice.
Ask a question, Jen. David, you mentioned the dinosaurial health professionals. So obviously a DIM, but what could, even if someone's trying to work on their SIMs, what does one do about that?
Yeah, that's a key question. First of all, I'd like to make the comment that the answer to that is partly political. So we do see groups like yours, like the Australian Pain Society and other groups, educating health professionals about the new stuff in pain. And there are a lot of people well behind. We also have a growing faculty of pain medicine in Australia. Many of them are good. Some of them are slightly dinosaurial, but we're trying to help that along. But I think when we go to a doctor, when we're in trouble at a health professional, we've known this for years. If you're sitting with someone and you're in pain, you basically want to know 4 things. And they should be answered when you go out. And those 4 things are, what's wrong with me? How long will it take? What can I do for it? And what can you do for it? And the idea of what you, the health professional, can do for it can also be found on the internet as well too. And I think any health professional's comments should make sense to you. And I think there's time to be brave and stand up and say, is there any science behind what you're actually showing us? And in my world, I've seen what's more been a patient-propelled change rather than health professional-propelled change. So, for example, we started teaching people skills of explaining pain, but then the patients were asking other health professionals, can you tell me more about pain? Some of you might have heard of the graded motor imagery work we do using mirrors and left-right discriminations and all sorts of stuff. Health professionals terribly slow to pick it up, but it's patients who are going to them and saying, hey, I've read something about this. Has this got any relevance to me? So you are also forces for change, every one of you.
Well, if you're going to be shy, I'll ask a question. When you were talking about SIMS, I was thinking that I've heard some friends who have chronic pain say, if one more person tells me to think positive, I'm going to punch them in the face. How much face punching can be allowed?
Yeah. I think you can tell people anything if you set the scene first. But I don't think just positive thinking, be positive, really sets the scene, I don't think. And I think in any discussion where you've actually got a balance between DIMS and SIMS, and not thinking positive, but actually doing positive, I think is probably better. There's no doubt that realistic positivity is a SIM, there's no doubt, but I think it's got to be framed in that overall big picture. And if I'm telling somebody that, there'd be probably 20 other things that they're doing, exercising, moving, adapting, work change as well too.
Yes. My name's Colin.
Hello, Colin.
I've noticed a strange phenomena recently in my own home. When my wife is at home, I experience a lot of pain. I don't mean from her. And when she's not at home, like I can be on a wheelie walker when she's home. When she's not at home, the pain is far less, almost not there. And I'm wondering, is this a sympathy thing that I'm looking for? Is it a DIM or a SIM or nothing in between? And the second question is, where did you get your shirt?
Well, I'll answer the shirt secondly, but that's probably the first one's probably one of the toughest questions ever been asked in a group. And it does sound as though broadly that your wife might be a DIM, but having said that, punch me out, this is probably in the audience, but it might not be her, but there might be the other things, the other issues, the other things that are happening around the house when she's there. There might be other issues. It might bring up other. She may well be a conduit to other deeper DIMs. When she comes, you might be, look, I don't know anything about you, but you might be reminded of your mother-in-law, or there might be other issues there, if I can be a little bit. Yeah. So that would be worth a deeper analysis, I think. And my shirt, well, I've been over in America, and you know, it's changed a bit now, but the Australian dollar was quite strong for a while, and we were quite rich for a while overseas. And there was a sale on in Chicago, and I went in and I came out with this shirt, and I had 8 pairs of pants, all different colours. I was like a bloody octopus. And I went out that night, and in a little bit of a suspicious part of Chicago, and in this shirt, I had my green Lumo pants, had purple shoes on, and I'm like this, and I'm out. And I walk around the corner, and there's this very big African-American man just walks around the corner into me, bang, knocks me back. He looks at me, up and down. I start to get slightly worried, and then he held out his hand and says, "Brother, you are styling." And I thought, what more do you need?
I like your shirt, David, because you've got a red and green. Red means danger, green means safe.
You picked it, and it's also a neuromatrix in the brain, 500 areas.
This chap over here.
Hi there, David.
Hello.
Beg your pardon. I get really nervous in front of crowds, so sorry. But regarding the Twin Peaks, our SIMS, will that reduce that bracing method that we have?
I'm sorry, can you just say it again?
Beg your pardon. Our SIMS, regarding the Twin Peaks, after post-injury, will that reduce the bracing method we have between where we feel pain and tissue damage?
I didn't quite get it, but the Twin Peaks model by itself is actually a SIM first. So, for example, when someone goes out and does a bit too much, they're often gone on the mountain into pain, but rarely up into tissue damage. It's just pain's been turned on, the immune system's turned it on. So the knowledge of that is actually a sim. Secondly, over time, with graded activity, exercise, appropriate diet, all those immune healthy behaviours, the tissue health can also improve. But there's a fundamental thing that when we're injured, we only get one chance. You go through the injury stages, as you know, of swelling and proliferation and scarring and sort of remodelling. And tissues can still say unhealthy, soggy boggy, can be more healthy, but you don't get a healing time again. So it can lift, but it's actually fairly slow. If you want to take that further with a particular question, I would be happy to catch you later if there's something deeper. Yeah.
That answers my question, thank you.
Thank you.
Hi David, thank you for the entertaining presentation. My name's Locke. Regarding chronic pain, why is it so many DIMS associated with chronic pain? And when you bring the topic up to clients, how do you bring it delicately to say that's not in the head? Because they do get quite offended.
Yeah, it's you know, that's a really important question. I thank you very much for it. And I wouldn't be surprised if there were some people here thinking I'm saying it's all in your head. Well, the truth is a lot of it actually is. It's in the total body. In the brain, it's measurable and changeable. Let me tell you how I would tell somebody they've got a smudge brain, right? That would be quite a challenge. First of all, I wouldn't go out tomorrow, first patient, and say, oh, I went to this lecture last night and your back's been a big problem. I know what's wrong with you, your brain's smudged. That won't go down so well. But I might say things like, we know our brains change all the time. The stories of the Braille, stories of people using it, and the languages, our brains change to look after us. And sometimes when our brains weigh the world, and the patient might have said, oh, there's been quite a few things you've told me, I can see how, you know, your brain has wanted to protect you more, and one way it's done it is to make that limb in the brain larger for you. And then I'd say, well done. And then I might say, actually, if you were to go to have a fancy scan, but I wouldn't because you don't need it, you can actually see these changes in the brain. They're real and they're changeable. And I don't think I would ever have a discussion with a patient without what I call the unity of brain and the body. So if it's a big swollen knee, I'm talking about input up into the brain, but I'm also talking about what the brain does to the knee as well too. It's a reciprocal pathway. And secondly and finally, I think we're getting better at doing it. And better at doing it is also part the multimedia out there. I think there's more and more people talking about pain on YouTube, and there's clips, and there's people demystifying the brain. And it's nothing to be feared. It's just a wonderful organ. And I would like to say that society has a very derogatory view of the brain. We don't have nice, clean, clear sort of metaphors for it. We always talk about steam coming out the ears, or half-wit, or youngsters talk about brain farts and all sorts of stuff. So it's always been a bit of a challenge to get people to take on the majesty of the organ itself. But yes, we're better at it. I think we can frame it. And I think that language for brain change, your brain has changed to look after you. Well done.
Thank you.
Thank you.
Well, you're a shy lot, so we are sending him back tomorrow to Adelaide, so you get one last chance. I feel like I'm an auctioneer at the minute.
Well, I'm going to give you a homuncular refreshment then. Before you go, hand on hand. Hand on hand. If you feel comfortable, pull a hand back and reach up to heaven. Lovely. Now do the other hand, up to heaven. Beautiful. Now I'm going to do some tricky stuff. One finger on finger. Pull the finger back, reach up and give a low groan. Ooh. Now next finger, and up the register with your groan. Ooh. Up the register even higher. And then, what have you just done to yourself? You've just done a wonderful mobilisation of the median nerve in here. A lot of people who do that don't actually need carpal tunnel surgery, which gets the surgeons a bit upset. But you've also done a lovely movement in there, and you've put the fingers back in the brain. And you put the fingers back in the brain in a richness of representation, because now there's a bit of noise up there with it. Better do the other side too, or you walk around in circles when you leave here. Up. Ooh. Next one. Next one. Ah. And higher. Ooh. Now a little bit of suntan cream in your hand. Rub it together. Very good for brain remapping this. Now put the sun cream, particularly if you're bald. Get your ears. Front, chin, cross your chest, down the thighs, and always that little bit behind the knees. Well done. Thank you.
And it's surprising what, excuse me a minute, it's surprising what a little bit of homuncular refreshment might do. This lady over here has been stimulated.
Me again. My name is Annie.
Hello, Annie.
I see DIMS as, simply put, negative and SIMS as positive. Is there a neutral? Is there something where you can, you need to actually just accept this is what it is without trying to pretty it up?
There's a couple of things there. First of all, in an acute injury, a DIM could be useful. So the danger that you realise can actually help you for a certain time. But yes, I think there is a balance. But even when there's a DIM that looks like it's not changeable, the key thing I think is that you're aware that that thing is part of your pain state. I think an awareness of it. And that in itself is actually doing something for it, which over time might lead to some form of a therapeutic intervention. Is that okay?
That's okay.
Yeah, thanks. Thanks.
And I think we have one last question down here.
David, you mentioned on that page, treating pain using the brain. What happens if the brain doesn't work?
Everyone's brain works. Everyone's brain works. Look at you here. There's 1 trillion cells in there. It's changing every moment of the day. It's the master organ. Everyone's brains work. It's nonsense we only use 10% and all this myth out there. It's in use all of the time. The master organs out there. And you know what? When we link into this education to notions of health literacy and what actually keeps economies and countries going. And if you're looking for the most underused resource out there, it's human mental capacity. And I think we need to tag that with education, and there's a brain there that can take it, and we know it changes right to the last breath.
And I'd just like to call on Linda Martin to say thank you.
Thank you, David, for an excellent and memorable Koadlow lecture. I'm just a bit worried about what's going to happen in my workplace tomorrow with all this and ahhing. But it's obviously time to embrace the pain science revolution and to get a grip on our metaphors. After listening to David speak, this may not have been enough time, or you might have been too shy to get up and ask a question tonight. But if you have any other questions, please feel free to ring our free helpline with our 2 wonderful nurses and volunteers on 1800 263 265 at any time, or visit our award-winning website. All that knowledge that we were talking about can be made available to you there. So we provide trusted evidence-based information on specific conditions but also treatments, as well as guiding people in navigating the often very complex health system. We also host webinars for health professionals and consumers and run face-to-face seminars, such as our lecture today. I'd like to take this opportunity to thank the Arthritis and Osteoporosis Victoria staff, and particularly 2 of our team, Jen Nolan and Olivia Lee. We've worked tirelessly to organise tonight's event, and we've been so delighted to have you all here, and it's wonderful to have the humour that goes with these often very challenging issues we have to face. If you haven't already visited the Arthritis and Osteoporosis Victoria information table in the foyer, please do so on your way out. Flyers for David's books are available on our information table, and we'll be sending a follow-up email to gain some feedback from you, and I'm really hoping that you'll take the time to give us that feedback so we can make sure we continue to run future activities that are useful for you. So thank you for attending. Have a safe trip home and work on those super sims. Thank you very much.
Super Sim.